Okay, so Giskin Day is from the Florence Nightingale Faculty of Nursing, Midwifery and Palliative Care and has the honour of going first. And their presentation is called Gratitude in Healthcare.
Thank you. 3 years ago, at the start of the pandemic, millions of people took part in a spectacular performance of gratitude to the NHS. Indeed, some of you might have taken part in Clap for Carers. And now all of that optimistic appreciation seems to have been undone. Of course, gratitude and goodwill cannot be relied on to save the NHS. But gratitude is an affirmative practice that validates the emotional pressures and the privileges of a career in caring. So, how should we think about thanking? What are the ways in which gratitude is expressed and received in healthcare? These are the questions that have motivated my PhD. So, I've carried out 3 interlinked studies. At the societal level, I've looked at tweets of gratitude to the NHS at the start of the pandemic and the rise and demise of Clap for Carers as a social phenomenon. At the institutional level, I've been privileged to work with an amazing archive of correspondence exchanged between staff at the Brompton Hospital and patients who were treated there for tuberculosis in the era before the NHS. At the interpersonal level, I had hoped to be making observations on the wards of the Brompton Hospital. The pandemic put paid to that. But if you turn on the television at any time of day or night, you will see high-quality footage of clinical interactions. So I've analysed hundreds of encounters of gratitude as shown in the BBC documentary series Hospital. Now, in scholarship, gratitude is most often considered to be an internalized psychological state, which is self-generated. But my study shows that gratitude in the context of care relationships is much better understood as a dynamic, linguistic, embodied social practice. In other words, gratitude is an emotion that is made in interaction. The implications of this are that unless we make space and place for gratitude in our healthcare settings, it simply will not happen. In healthcare, there is a tradition of only considering complaints as being capable of driving change. A recommendation from my thesis is that we really need to pay attention to what people say that they appreciate. We can learn so much about what people value about their healthcare experiences. As we reimagine care justice in the wake of the pandemic in the NHS, for patients, but perhaps particularly for staff, we need to change our attitudes to gratitude. Thank you.